Hello, everyone. Welcome to the webinar on integrating patient-family engagement into the Choosing Wisely implementation. Before we start, here are a couple housekeeping items. You can download the slides and resource materials from the handout pane. We encourage everyone to participate in the conversation by typing your questions and comments in the chat box. Please note that you will be mute until the Q&A session, and if you wish to speak, please click the hand button to raise your hand, and you will be unmuted when it is time for questions. And after the webinar, send you the recording of the webinar, and we'll post the slides and resource material for download at the PCPCC website /webinars. And last but not least, please take the post-webinar survey. Your feedback will be greatly appreciated. About PCPCC, PCPCC, our Patient-Centered Primary Care Collaborative, aims to advance an effective and efficient healthcare system built on a strong foundation of primary care and the patient-centered medical home. Our mission is to promote collaborative approaches to improve primary care. We focus on the concept of patient-centered care through patient-family engagement and patient activation, which will help reach the goals of improved cost, quality, experience, and outcome. We also promote the shared principle of primary care, which represent all aspects of primary care. Throughout the Transforming Clinical Practice initiative, PCPCC, SAN, and Alignment Network strive to improve patient and family, clinician, and community strategy for engagement. We're working with our key partners to provide valuable education programs and technical assistance tools to help practice meet their needs. And to learn more about how can we help your practice, please visit pcpcc.org/TCPI. And now I would like to turn to my colleague, Kelly Rand, for today's webinar. Kelly, please take it away.
Thank you, Tanya. Can you switch to the next slide?
Great.
So we're really excited about the response we've gotten for this webinar today, and we have a great panel of speakers. Today we're going to be talking about taking Choosing Wisely patient engagement to the next level by really bringing in the patient voice and involving the patient from the very beginning of the process. So today we have speaking with us a wonderful patient voice. Janice Tuft is an engaged patient partner in health systems improvement, receives care at Kaiser Washington. Janice has participated in more than 6 patient-centered outcome research institute-funded projects, from conference involvement to patient co-investigator, and is involved with measurement and guidelines, adding the patient and public perspective to addressed subject matter. Janice has been a member of a collaborative effort addressing low-value care and research, serves on the advisory panel for the same, and she's also a member of the ABIMF's Choosing Wisely Patient Engagement Advisory Council. Dr. Lisa Letourneau is a physician consultant for the Choosing Wisely Learning Network. She previously served as Executive Director of Maine Quality Counts, a regional health improvement collaborative. Dr. Letourneau is a graduate of Brown University and Dartmouth-Brown Program in Medicine, and is a board-certified internist and holds a master's degree from Harvard School of Public Health. Mary Minetti is a certified professional in healthcare quality and has over 30 years experience in the field. She joined the Institute for Patient and Family Centered Care in 2011 and works as a senior policy and program specialist. She was lead author on a Robert Wood Johnson Foundation funded report, Individual and Family Engagement in the Medicaid Population, Emerging Best Practices and Recommendations, and IPFCC's publication, Essential Allies, Patient, Resident, and Family Advisors, a guide for staff liaisons. She currently serves on the Circle of Champions to advance the adoption of TCPI person and family engagement performance metrics and provides technical assistance to TCPI. Next slide, please. So as I mentioned, we're excited about our talk today. We're hoping at the end of this talk that you'll be familiar with condition-specific Choosing Wisely materials and insights from our patient advisor on using those materials. We hope you'll gain an understanding of successful Choosing Wisely implementation scenario. We're going to try to give you both, one where you're engaging the patient both at point of care, and then look at it again and see how much more value you can add by involving the patient engagement advisor from implementation. We're also hoping that you'll hear practical starting places for involving patients and families in implementation in general. Next slide. As always, we like to tie it to your goals. Again, we're hoping that by seeing how you can involve the patient from the beginning of the process of implementation and hearing their voice, that you not only see how you can support that patient and family voice, but how you can add richness and depth to the implementation programs that you're doing. We are going to give a number of tools that will help you do shared decision making and informed decision making and integrate that into your workflow. And we hope that everything that we do by promoting Choosing Wisely is promoting conversations and promoting the active role of the patient in making decisions about what care is right for them. So next slide. I'd like to turn it over. We're going to start off our presentation with the most important voice that we think to talk about when we're talking about a patient engagement, and that's Janice, who will be representing our patient today. Janice.
Thank you for having me today. So I just want to add that, or start out with, I had been a patient and family advisor at what was Group Health and now Kaiser for about 5 years and regionally. And then I moved into, I was asked to be on a research project that addressed the social determinants of health. And while on that project, I believe I noticed when I was at the doctor one time, the Choosing Wisely materials in one of the offices. And I had read it, and I actually was aware that our health system had, implemented whatever to eliminate low-value care or overuse and underuse was really built into the system. But my story is, I have a history of lung problems. I've had pneumonia multiple times. As a child, had a collapsed lung, had asthma, was treated for it for decades. And at one point was receiving regular breathing treatment. And a few years ago, or shorter than that, I had a persistent breathing issue, and it wasn't being treated with asthma medication. So I finally went in to see my primary or my doctor, and I see residents more often than I see my primary, which is fine with me. And I had a wonderful young doctor, and she saw me and she said, yeah, I can tell there's some, crackling in your lungs, but we really don't believe this is pneumonia, and you've had quite a few x-rays. I used to be x-rayed a lot because of my lung problems before systems really realized this is not good for you. So I just felt I really needed this. And she sat down and was very honest with me about how the radiation can be more dangerous and in antibiotics as well, and didn't really feel it was necessary, and to just rest and drink more liquids, and if it persists, to come back in. So I said, well, I really think I need an x-ray. I was very persistent. And so she sent in the attending, and he confirmed with her what he felt. And in all honesty, I don't know why, I just insisted on having an x-ray, even though I'm aware of, low value care, but I just wanted to be sure and rule out that it was not pneumonia. I have a spot on my lung I've had for many decades. We don't know for how long, maybe from when I was a child. I just wanted that checked out. That fear came up, right? So after I left, I actually contacted my primary care physician via note, via portal, and said, I really feel it's important that I have this x-ray. And he, to be honest, caved in and gave me an x-ray, right? So there was nothing wrong, and it's the same as it has been. And it was a reminder that because perhaps so many years had gone by before I'd had, since I'd had an x-ray, that I was just going back to my fears of having pneumonia or something stronger. And in truth, I did not listen to the resident, the attending, even my primary care doctor said, you know, they're most likely correct, but we'll do the x-ray if, you know, if this is what you really want. So from that, now I remember I have that spot on my lung, and if I have anything persistent, just really to listen to the doctors. And I can't even say it was an issue of not trusting. It was just an issue of my insistence, which I feel is really an issue in many practices today, where the patients might insist on, you know, care that might be low value. So that's my story on my chest x-ray, and you can see it in the picture. You can hardly see the little white dot. You don't see it very well on the left lung. But I think we can go on to the next slide. Thank you.
Super. Well, thank you so much, Janice. This is Lisa Letourneau jumping in. So as Kelly Rand mentioned, I am an internist and have the privilege of serving as a physician advisor to the American Board of Internal Medicine Foundation's Choosing Wisely campaign. I'm going to go fairly quickly over my slides because I'm guessing that many of you on the call are pretty familiar with Choosing Wisely, but just by way of background, Choosing Wisely is an effort of the American Board of Internal Medicine Foundation to help really patients and clinicians engage in better conversations. Go ahead, Tanya. About overuse, particularly of tests and procedures. Whoops, I think we maybe skipped one. There we go. So from our experience really working with many, many great organizations around the country, both provider organizations and my organizations like my former organization, the Maine Quality Counts, which I'm going to reference more in just a minute, I think we've learned a lot about what works when thinking about engaging patients in this. So a lot of our conversations, certainly in efforts with Choosing Wisely, are working with clinicians, and perhaps even more importantly, as we're talking about today, is how do we engage patients in these conversations, whether we are different members of the practice team or clinicians in those in-office conversations. So certainly some of these tips, I think, are things that we've learned from. You can see a lot of these things referenced through a whole set of resources on the Choosing Wisely website, but being sure to frame the conversation as a positive thing, as something that's related to patient concerns about patient safety. We have learned that it's probably not helpful to lead with conversations about cost, but about what this really means to the patient, making sure that we're spending time and emphasizing our concern and caring about them, trying to avoid unnecessary tests and treatments because we want to avoid harm that can come from those tests or the results of doing unnecessary or unneeded tests. Certainly confirming agreement, you know, having a collaborative conversation with patients can help as well. Go ahead. We, again, through these efforts and really the years now of experience working with clinicians and patients, have learned, I think, a lot about how we frame the Choosing Wisely messages and can reflect what we know it is that patients want from clinicians, which is somebody who knows them and cares about them and coordinates their care over time, right? So making sure that we respect those wishes from patients, that they want to hear from their clinicians, they want to be involved, they want information, and again, keeping that focus on safety, using plain language, and then using a variety of ways to get the messaging out, I think can be helpful. Go ahead. Sorry, a little background noise here. We have also had the benefit of ABIM and the Choosing Wisely program developing many, many resources now. So you can see here there's a whole range of informational sheets, brochures, video clips, rack cards that can be used in practices, wallet cards, etc. Many are available in both English and, importantly, plain English, specifically developed in plain English terms for patients, and several in other languages, including Spanish as well. Go ahead. We've seen our partners use these tools. You can see my old friend here, Rhonda Selvin, and Maine Quality Counts using that in an exam room. You can see lots of different ways that people have incorporated, whether it's posters or racks of Choosing Wisely materials right at the point of care, commitment posters in exam rooms, wallet cards for patients. Go ahead. So the point really there is you don't need to reinvent the wheel. There's been a lot of work by both ABIMF and our partners to develop these patient-friendly, patient-oriented materials. Also wanted to give a shout out for a really nice toolkit that my colleague Kelly Slate-Cabbage and team developed at Quality Counts. This is available on the ABIM, the Choosing Wisely website, and it's just a great toolkit to help clinicians and practices put this into the patient visit, from things like flow charts that you can see here. How do we do this from the minute the patient hits the door through the course of the clinical visit? Go ahead, to very practical tools like scripts that have been developed for use by providers and with patients as well. So you can see here some sample scripts. When a patient service representative or PSR maybe starts the visit by giving the Choosing Wisely 5 questions, a sheet or a wallet card at check-in. What kind of wording, language can they use to introduce that to patients? And you can see a sample script here, maybe as the visit progresses, asking the patient about, do they have questions, or maybe if the first way didn't go so well, they weren't comfortable, an alternative kind of script. And it goes down. We don't have the whole page here on the chart, but includes sample scripts for providers to use with patients as well. Go ahead. So just a lot of really practical tools, again, that you shouldn't have to reinvent. And we know these things can work. So we know from studies of Choosing Wisely materials that before reading topic-specific information, in this study at least, less than 16% of patients cited interest in the topic, and after reading we can see considerable improvement in both interest, willingness to talk to their doctor, or even changing their mind about thinking maybe that they, for example, might need an x-ray for uncomplicated low back pain. Go ahead. We also know that decision aids in general can work. So materials such as Choosing Wisely, information sheets, can really help people make informed decisions and increase their participation in shared decision making about tested procedures. Go ahead. So through a variety of efforts, and again through activities that have been funded by RWJ and Robert Wood Johnson and the American Board of Internal Medicine, working with provider groups throughout the country, I think we've got some key lessons learned that doing multiple things helps, right? Both displaying patient materials throughout the length of their journey through their point of care, putting materials, Choosing Wisely materials directly into patient portals. So say they're registering for a visit for low back pain, having that Choosing Wisely sheet come up ahead of time to help educate them that, for example, imaging might not be necessary ahead of the visit can be incredibly helpful, right? And changing and forming patient expectations so it's not fighting upstream all the time, right, against the sort of American ethos of I need everything all the time. Incorporating conversations into the workflow, again, all the way from the patient representative at the front desk, through the person rooming the patient, through the clinician seeing the patient, getting the message out more widely, perhaps working with your marketing department or communications department of your institution, and then again framing those messages on personal risk, safety, and possibly financial harm, patients' financial harm. Not so much financial harm to the big system. We know that resonates less well, but as patients increasingly have high deductibles and high out-of-pocket costs, helping them avoid patient unnecessary tests and financial harm from unneeded testing or procedures or treatments, and most importantly, certainly collaborating across all the members of the system, and particularly with the patient. Go ahead. So just a quick look at, how could things look different? So in a typical, sort of historical approach, right, we might approach the issue of a clinic X, say, that notes that when they're looking at the rates of imaging for low back pain, uncomplicated low back pain in the first 6 weeks, they look at it and it turns out that over 50% of the time, studies such as plain films are being ordered, which we know is not supported by science. So what do? They take it on typically, right? We talk about it. We talk about staff meetings. We talk at clinician meetings. We might share the standard of care, clinical guidelines, or articles, and inevitably we see either very low impact or maybe unsustained impact on behaviors to maybe even no change in actual behavior at the bedside, because we're fighting, again, kind of the expectations, the anticipation of expectations from patients, and the normal way things are done. So what about in a choosing wisely approach? Well, perhaps we're sharing those choosing wisely recommendations with clinicians. We're doing system-wide, staff-wide training and education. Perhaps we engage a clinician or physician to serve as a champion, doing one-on-one academic detailing with the other clinicians and talking about their individual rates of imaging. How are they doing compared to their peers, to the practice overall? Looking at how they could change practice workflow and maybe putting, again, information tools, ideally even putting perhaps a hard stop in the EMR around their clinical decision support, and putting posters and prompts right in the exam room. I think we have good evidence to show that when a multifaceted approach like this is used, particularly with engagement of all the way from frontline staff to clinicians, and importantly, partnering with patients in the practice, we can see improvement. Go ahead. And from there, I'm going to turn it back over to Janice to talk about how some of these materials have been experienced and used by patients in practice. So, Janice.
Thank you. I appreciate that background, and I just want to add that it's wonderful to have these materials available in the doctor's offices. And I have seen them particularly in 2 offices, in gastroenterology for colonoscopy and for back pain, but I have seen it in other primary care offices for some specific conditions or tests as well. And they're very self-explanatory, I guess the best way to put it. I go onto the website, and go on to choosingwisely.org. You can find the materials there, and you can search through the different subject matter or conditions and choose what perhaps you might like to look at and to view. And the treating lower back pain is what we're going to talk about a little bit today. But I just want to also add that the full sheet, I sort of like lower vision, so it's easy for me to read. They also have the cards, the little cards that have the five things to ask your doctor, or I'm not sure if we have the 5 ways for being smart about back pain, but that would be a good idea to have cards on that. And I just want to emphasize to everybody on the call the importance of just going to the website and seeing what is available and how you might be able to use that in your practice or within your patient and family advisory council, and how us as patients are able to further bring choosing wisely more to the greater population, the greater patient population through our voice. Next slide, please. So what I'm talking about today is back pain, and I have had recurrent lower back pain. I hurt my back in the, actually the 70s, late 70s skiing. And so over the years, I have gone to a doctor about low back pain. And I actually, they've had me seeing a surgeon, actually. Wanted to see about surgery, which like scared me. I'm like, surgery's a little bit strong, and that's not something I had any intention of doing. And the doctor that came in, sat down, went over with me, and discussed that really he felt the next best thing for me was physical therapy, and also, a few other options like heat and ice, at-home remedies, bath, and mindfulness. And what he prescribed to me was this book, and he showed me the book. And honestly, I just took that with a grain of salt, and I ordered the book, right? And I did do the exercises. And the funny part of this story is that I was at an event with physicians. I'm not a physician. And I mentioned this to this physician, and he said, there is no way my patients would buy a book. And I said, you don't know that until you tell them, or ask them if they'd like to do it or prescribe it to them. So there's other alternatives. And I really respect that in our KP Washington and a lot of the KPs, we have Choosing Wisely basically embedded into the ER and into some patient portal in the aspect of e-consults, where it will say at the bottom of a specialist summary, basically what it'll talk perhaps about back pain. It'll tell about imaging. It'll tell, it'll give percentages and why it's not the best. But as was mentioned earlier, this is something that could be implemented much more throughout our system. And so in KP, I just looked up, this is a public page, like how is it treated? So often people might go to Google, but just looking in your own health system, you might find that there's information there for you. And if not, you're welcome to go to KP because they do have a lot there. And Primary Care Collaborative and Choosing Wisely would be my first line of entry. But I do want to say I did not, of course, have back surgery. I no way wanted that, but I did have physical therapy, and that worked quite a bit. And I appreciated what I learned from the book. It was easy to learn from, and I just would like to see low back pain imaging and overuse of tests pretty much eliminated from our system. I think most patients think about procedures and the dangers, but they don't always think about the dangers of tests as well, of overuse. And I believe that's about all, and I could answer any questions later. Now we could to the next slide. Thank you.
Thanks, Janice. I appreciate, this is Mary Minetti, and I appreciate the opportunity to share with you an aspect of engaging patients and families as implementation partners as you're beginning to explore utilizing these wonderful tools that have been created under the Choosing Wisely effort. But before I go there, I wanted to make a couple comments about Janice's stories over the time of the webinar. Her first story being about that the organization had systematically identified ways to reduce unnecessary x-rays of the lungs and had approached her with that new standard of care. And despite their best efforts, she continued to persistently share her concern via, I really need an x-ray, and ended up getting what ended up being an unnecessary x-ray. But if we step back and look at the opportunity in terms of patient engagement at the point of care, I think there was a missed opportunity. It's great to have our systems standardized. It's great to build on what is the best evidence. However, in the initial contact with the patient and family, it's all about getting to agreement and making sure that the patient feels heard. And sometimes what we want to hear in that interaction isn't about the evidence first. What we want to hear first is that we've been heard. And part of Janice's story was about, she had a whole context and a whole history of experiences with her lungs that went way back. And that in that intervention, in that moment, not recognizing some of the anxiety and the concern and the historical perspective and the emotions and her feelings that were rooted in her lived experience, and not addressing those issues first and going right to, you don't need, based on the evidence, an x-ray. Often the response that all of us normally when we don't feel heard is we continue to try to send our message. And so I encourage us, as we think about the implementation of Choosing Wisely, next slide, to remember that very important issue in any encounter, which is the goal setting. And decision aids are really important, but in the development of care plans, it's really about connecting and meeting people where they're at, understanding not just the science, but also the human connection, so that Janice may have been, and many of us may be able to get to the same page with our clinicians if first we feel validated in our feelings and our anxiety and our concerns, so that we can work through that and then move to the next level. But part of what we want to do in this section really is talk about, next slide please, how we engage patients and families who have lived experiences, who can help us understand the impact of these new standard practices with Choosing Wisely tools on us. And I just bring to your attention that when we involve patients and families to help influence how we implement things, they become a real key lever for transformational change. They can help us see things from the perspective of the patients and families that we might not build into our new systems of care as we implement any decision aids, but especially these. Next slide, please. So what I would like you to begin to think about is how you can invite patient and family participation. Next slide, Tanya. Thank you. Into the opportunity to help you in the implementation. So they can bring us insights about how we might introduce these changes to our patient and family population to better engage them. They can help us think about, well, we're used to not understanding about the science, and we might be reticent to, if we've been used to being prescribed antibiotics when we go in and we're not feeling well, we might be reticent to really get on board with that new treatment plan. So how can we introduce these practice changes? They can help us with that. They can, as we look at there are so many wonderful Choosing Wisely tools. They can help us understand what tools are most useful to them, and to start with those tools that are going to be more approachable, those things that really resonate with the patient population. I had a patient and family advisory counselor at a medical group who really helped a practice identify where to place materials and tools like those posters that were in the slides that Lisa shared, to increase their visibility, because patients and families understand how they move through the physical environment and where are the places that their eyes land, where are the places where they might really have those things pop out. One organization had patient and family advisors help them put together an informational, it was a TV screen, a media screen, but where key informational messages were placed in a number of languages as people were waiting to be seen and taken back to exam rooms. And those advisors helped them think about how some of the key Choosing Wisely messages could be integrated into those kinds of things. And patients and families can really help us evaluate the success of the implementation. Obviously, any organization, if they are implementing and looking at what is their use of unnecessary imaging on low back pain in the first 6 weeks of the condition, those are some objective measures, and hopefully that number would go down so that you can get more in line with science. But you also want to have patients and families help you think from their perspective how you might evaluate the success of that implementation. So these are just some of the ideas that patients and families can participate in, ways that you can invite them to make a difference. Next slide, please. And part of the reason that we want to do that is that we want to make sure that we're not making assumptions about what patients and families think about this new change, but actually invite them to share that. They often offer simple solutions about how we do an implementation of this sort as it relates to the way that we would want to include them in the implementation. We can begin to ask them what kinds of tools and how that tool affects them. They can provide information to help us make better business decisions. For instance, if we're asking them what tools resonate most with them and are most likely to be adopted by patients and families and are helpful to them, we can start and create success in that implementation, building trust with our patients and families as we implement other kinds of tools. And they can help us think differently about how that conversation goes and what that might mean and what some of the messages and confusions in any script that we can create can be improved through the involvement of patients and families in reviewing scripts or helping us create those messages in those scripts. Next slide, please. So one of the things that you have available to you as a download is a document that we created collaboratively, PCPCC, STAN, and Choosing Wisely and IPFCC, about how to involve real concrete ways to involve patients and families in implementing Choosing Wisely tools. For instance, one thing that you can do is you can sit down with one patient and share a Choosing Wisely tool that's relevant to tests or treatments that they've had in the past, and ask them about the information and have them give you some feedback about how the information could have been useful to them in making decisions. You can give patients and families in an advisory council a list of topics that could be addressed through CW and ask them to select them. Bringing together a group of patients and families to review a small number of specific tools that you're looking at implementing that are related to their own lived experience, and asking them which tools they find most useful and why can help you in your decision making as you're looking at implementation. So it's really important as you're looking at implementing Choosing Wisely that you are thinking about broad questions. For instance, how can our clinic communicate with about the Choosing Wisely program to patients and families? Patients and families can help us think through that. What messages help us start meaningful conversations about certain topics that we're trying to address that have low value and may not be useful in helping patients meet their goals? So these are the kinds of things that and questions that you want and are outlined in more detail in this tool that you want to begin to have with patients and families, because without their input, sometimes our implementation isn't as successful as it could be with their perspective, because they help us have a 360-degree view. The standard process that Lisa talked about earlier is a very robust process in evaluating and implementing and making behavior change in the clinic as you're implementing Choosing Wisely tools. And every one of those steps is very valid. And if we can add a step that involves and invites patient and family participation, that can really make a big deal and make a big difference in how we approach our partnership with patients and families. Because ultimately what we want to do is we want to create an environment where we activate, we build skills, confidence, and knowledge with our patients so that they and we together can make decisions that will help them move closer to their health goals. And that knowledge presented in plain language and in ways that really recognize and support them is really important. And the decision aid of Choosing Wisely is a really strong decision aid that shows much promise in practices across the country, whether they're specialty or primary care practices, whether it's in a hospital setting or an outpatient setting. Next slide, please. One of the things that we wanted you to be aware of is that individuals who are very interested in continuing to build engagement with patients and families and advance patient and family-centered care and the implementation of useful and affirming tools such as Choosing Wisely often are interested in learning from their peers about what's working and things that aren't working so that together they can continue their learning. And so we wanted you to be aware of a free online learning community that we've created that's dedicated to partnerships with patients and families. It's a free online learning community and it's virtual, and you can create networks with other individuals who are in similar roles to yours or in similar settings to yours, We also host ongoing informal conversations where we get together and discuss different topics such as health literacy or decision aids or patient and family activation, so that we can learn from each other in terms of the kinds of strategies that each of us is doing in implementing these really important programs such as Choosing Wisely. Next slide, please. So I know that we wanted to leave some time for discussion and for questions. So I'm going to turn it over to Kelly.
Thank you, everybody. There's a lot of information to cover and a lot of ways that you can engage patients. So we're eager to talk to you about questions that you might have or thoughts that you might have. So we're open to questions. Marilyn, is there anything in the chat box for us?
Not yet. There's nothing yet.
All right. Well, sure. Go ahead.
Oh, it looks like we have 2 people raise their hand. So first, I will unmute Susie Smith. And Susie, you can speak now if you have any questions.
Actually, it was an error. I apologize.
Oh, not a problem. Okay. And another question we might have is from Jane Roulette. Jane, do you have any question? You are on mute already. I guess not. Okay. Again, attendee, please feel free to click the hand button if you have any question, or type your questions or comments in the chat box.
And maybe I'll start the question off. I'm sorry. Did somebody want to say something?
Okay, it's just Lisa. I was going to do the same thing and offer a question myself. But go ahead if you want, either one.
You start, and then I'll go,
okay,
if there's no more.
All right. So I will just ask either Janice or Mary, if you are one of the folks on the line who either works in a practice or works with a practice that is not doing much of this. Maybe they're aware of Choosing Wisely, maybe they've got some sheets, but they haven't really started this in earnest. Where would they start? Give them some top 3 things they would do or could do.
Related to Choosing Wisely or related to inviting patients and families?
I would combine those two, related to how to implement Choosing Wisely in the practice in a way that respects the role and ideally engages patients and families.
So I'll share a couple of thoughts, and then Janice, I'm really interested in what you would have to say. So the first question that really needs to be asked is, what topics or tests or procedures are most relevant to our practice? So Choosing Wisely has many, many tools. And so prior to even beginning to invite patients and families in, I think a practice needs to go out and identify what are those 5 to 20 topics that are related to their practice. And then to bring patients and families in who, once you've identified what those topics are, to bring them in. And it doesn't have to be a lot of patients. You don't have to have an established patient and family advisory council. One organization had a physician champion. Physician champions are important, and they were interested in a particular tool, decision aid, to bring in. And they identified 2 or 3 patients in their practice that they were familiar with who had that particular condition or had in the past had to make decisions in partnership with them about a particular procedure before they had implemented Choosing Wisely tools. And then they just invited those patients either through a phone conversation or by coming to the practice during a lunch hour to have a conversation, to show them the tools, to talk about what the practice was trying to accomplish, and ask them in an open-ended way, what are you thinking about this? What feedback would you have to us of what we might want to consider as we approach doing something like this. What are some messages? And just begin the conversation by, one, setting the context of what are we trying to accomplish, and why do we believe that your input is extremely valuable, so that you can begin to help people understand the context in which you're having the conversation with them. And often from there, the practice begins to invite more and more patients in. But you have to start small often if you haven't got an established patient and family advisory council, and you haven't practiced involving and making quality improvement changes to process flows without patients and families involved. So that's one way you might start. Janice, did you have some comments that you wanted to share?
Yeah, sure. I just would like to, I guess, share on to what Mary had just mentioned is extremely correct, I guess. But there's ways to go about bringing patients together, and if the clinic and or system identifies where they're having, where there is use being done that should be either decreased or should be increased, could be either way, it could be prescriptions or tests or whatever procedures that they bring together. They could identify patients that are involved in those areas. And I would suggest having a meeting with food. You'll get people there, and then just asking them what they think about this and how is the best way to approach it. Because not only is it about what we have available currently for Choosing Wisely, but it's also about what is not currently available in Choosing Wisely, right? Like, I'm not sure if some of the opioid crisis is in there. There's other issues of mental health that might not be addressed in Choosing Wisely, and how patients can draw up what they see are some of the biggest drawbacks that also align with what the clinicians like. So to have a meeting, to identify patients and family members, have a meeting, and then to synthesize that and perhaps afterwards send that back to the individuals that were there and ask for their feedback. That's what I would do. Thank you.
The other thing that I think about is that many organizations have patient portals, and they can create within their registration for their patient portal. They have an electronic way to communicate with patients. They can create one question that they can add to their registration, which is, our practice is interested in working with patients and families on implementing improvements, positive improvements to our practice. Are you interested in helping us by providing your ideas and perspectives? And they can create a list of patients and families that have said yes to that question. And then when they're getting ready to implement something new like Choosing Wisely, they can send out a request to invite patients to say, we are looking at implementing some patient education decision aid materials on the topic of X, low back pain. Would you be interested in helping us review them and think about how to use them in our practice? And then people can respond yes or no. And what they've done is they've created a system, built on a system they already have, and created a system by which they can easily communicate to patients they're going to make an improvement, and then have patients respond so that they easily can identify patients who have an interest in a particular topic.
That's a great segue into the question I was going to ask. So really talking about people who haven't maybe been able to involve patients and families yet, I'm sure there's people who would automatically volunteer to provide their opinion, but there's also probably a lot of valuable voices that don't necessarily feel confident that they have something to provide. And I guess I'm interested in finding out what sorts of supports could be easily offered to help patients feel that autonomy to provide their voice. And I'd also really be interested, I guess, in hearing Janice's story of how she got involved in this. What made you switch from a patient to an advocate in the healthcare system?
Thank you for saying that. It's interesting. I'm involved with many patient partners, I like to call it, from around the nation who are involved either in research or, patient family advisory councils, and at deeper levels, TCPI and SANS and so forth. And basically all of us became involved because most of us have had some sort of adverse event, right? So something clicked in our head that isn't quite right? So even when I had my pneumonia, I wasn't sure if I really should be having those breathing treatments once a week, right? And this was in another health system, but at the time it was the best evidence of the day. So actually what kick-started me to getting more involved really was working within the research, and which was, we had our implementation, our intervention was a community resource specialist in the primary care clinic, and it was considered successful and beneficial to the patient. So it was scaled to all 26 clinics in Washington State where where the CRSs could share information with the patients. I mean, they could even share Choosing Wisely too as well. But I just realized that there was a lot of overuse and underuse. And as I was involved nationwide as a patient partner, a PCORI ambassador, I realized, wow, so many people don't even realize that they shouldn't, that, having an x-ray for low back pain isn't necessary. Something like 90%, 95% is not necessary. It's generally at-home care. And then if it persists, to have an x-ray at some point. But still, x-rays were being done and patients were insisting on it, similar to what I had done regarding my lungs. So it's interesting, and I find the biggest challenge is how can we introduce this into communities where they maybe feel marginalized and historically have been marginalized, and to include them. I mean, it's so important wherever you do involve people that there are groups that are inclusive of the population that is being served, right? That their voice is there. But over and over again, working with individuals and Choosing Wisely tools, it is found that they are activated afterwards and realizing that tests and not just procedures can be detrimental to your health rather than advantageous. I hope that answered. You're welcome to write to me afterwards if you'd like to, and call. You can get the information from the leader. So thank you.
And Kelly, it looks like we have 2 other questions.
Great, we'd love to hear.
Yes. Great. Yeah, go ahead, Marilyn.
Okay. One of the first questions I had from Peter Lowe is how to access patient-centered training material for new staff. And from Patient-Centered Primary Care Collaborative, if you go to our website, www.pcpcc.org/TCPI, we have our webinars that we've held in the past, as well as tools that we have given out. And so you would have easy access to the tools there. The others may want to chime in as well.
Yeah, for the Choosing Wisely resources that we mentioned today throughout the conversation, it's at choosingwisely.org, and I'm happy to put that into the chat box. But you can also get, I put directly the posters and the patient materials in the handouts, but on the same site in the resources section, it's the section's called Getting Started. We have things like the toolkit that Maine created that help with workflows and scripting. And we have a few patient engagement resource materials that talk about the lessons learned that we have from the projects that we funded.
And then we have a number of free downloadable tools as well at the www.IPFCC.org, as well as a monthly newsletter that we send out that shares advances in patient and family-centered care. So people are are welcome to look at our website and look at those downloadable tools. We also have a whole special, on the right-hand side of the toolbar, there is kind of special topics, and one of those has to do with how you invite more diversity among your patient and family advisors, and how you utilize a variety of ways of outreach to build those partnerships that may not as easily be created. So you're welcome to go out there and take a look.
I'm
sorry.
Oh, you said there was another question?
Yeah, I think we may have answered this, but this is from a Bill Abrams, and it says, how would you suggest getting a clinic that isn't using Choosing Wisely to start? And he actually has left the call, but I think that the information that you gave in the beginning probably covered everything that he was looking for.
Yeah, and I mean, if anybody else has that question, I would say one thing to start with is starting with the 5 questions, just bringing up the idea that overuse exists and that questions are available and open, and that your clinicians are happy to talk to the patients, not just about what the clinician thinks the care plan should be, but also eliciting preferences and talking about what risks and benefits might be for each test and treatment. And this is also a great opportunity to say that for people who are interested in Choosing Wisely implementation, Lisa Letourneau and I are happy to talk to you about first steps in planning. So if you check in the evaluation at the end of this that you're interested in implementing, we'll reach out to you in email form.
Great. Thank you, Kelly. It looks like we don't have any other questions, and we are also close to time. So I would like to thank you everyone for participating in the webinar. And you can stay connected with us, PCPCC, through social media, and please feel free to explore our resources at pcpcc.org/PCPI. And if you have any question or anything that we can help you in your practice with, please reach out to us from the contact information on the slide. Again, thank you everyone, and I hope everyone have a good day.
Thanks so much.
Thank you.
Thank you.
Thanks all.
Thank you.